Hello, everyone. My name is Helia Singh, and today again we are here with another episode of Wealth and Health Podcast. The vision of this podcast is to help you to become healthier, wealthier, and wiser for this year, and hopefully beyond that. And like other episodes, we have an expert here to talk to us about the health side. And as you know, so I can talk to you about wealth all day long, but when it comes to health, definitely even I need a lot of advice in that area. And without further ado, I would like to introduce my guest for today, and that's Dr. Siti Aireena Ab Karim, and she is going to talk to us about her views of health and wealth and how they all are related. So thank you so much, Dr. Siti, for accepting our invitations and giving us your valuable time. Before I start my questions, would you please tell us about which area of medicine you are practicing and tell us a bit about yourself? Thank you.
Thank you for having me. It's a nice opportunity. I'm Dr. Siti Aireena Ab Karim. I'm actually originally from Malaysia. I graduated from a university in Indonesia, but then I have about 10 years experience in medical practice. And then I took over my late father's clinic from 2015, so around 5-6 years. And then I just moved to Perth last year because my husband is Australian. So I'm just managing my clinic remotely while I hired another doctor to sit there to see patients. So I'm not really physically seeing patients, but I'm still overlooking the clinic in the management part. Yeah.
Oh, wow. That's wonderful. So you are not only a doctor, but also you are an entrepreneur managing a clinic. I think that's a big job.
Thank you. I have good people on board, so I'm thankful.
Yeah. No, wonderful. That's great to know. And we like to see more women who are doing management work. So yeah, that is definitely a good role model for many other people to see that there is, especially now these days with technology and everything, there is no boundary in what we can really achieve if we want to really put our mind to it. No, that's wonderful. That's great. I didn't know about that with you. So yeah, that's good. So yeah, without further ado, because I know your time is very valuable, so I would like to start my questions, if you don't mind.
Okay. Yeah.
First question, what does wealth mean to you?
My view on wealth is having sufficiency and freedom. Like I feel you need to have independence and free of debts, especially free of debts. And also when you have enough, you are able to contribute some without worrying that you're having less than what you have. So because when you have enough for yourself and you do not have to beg from anyone, and you have enough to give away also. Because in Islam, actually, when you are granted with wealth, you're blessed with this kind of wealth, you are actually strongly advised to give part of your wealth to the charity or anyone that need it. Because we are actually very discouraged from spending our wealth extravagantly. Because if you have more, you are blessed with more compared to the others, so you should give out more. So like there should be a balance. Like if you have one nice car or two nice cars, it's okay, but having like 10 nice cars is extravagant. Like having one luxury handbag, if you can afford it, it's fine, but having 50 is extravagant. So I think that's
interesting. Yeah. I like that approach because, of course, whoever is blessed to be, doing well, and of course, there is behind it is hard work, dedication, studying, and all of that. But at the end of the day, we are lucky to be in that level. So yeah, that's why it is the time to share it with others. Or actually, I've heard from one of the wise people that I dealt with him a few years ago. I've heard something very interesting. He said the best way to help poor people is not to be one of them.
Oh, wow.
Yes. So yeah, if that's why wealth is good, but if you are not to become one of those people, and then actually help them. So
Yeah.
definitely that's the different approach.
How
So
can you help if you're in poverty? Yeah.
exactly. Exactly. And when you are in poverty or if you're poor, so whatever charity you can do to others is only limited to your, body and whatever you can do right now. But when you
Yes.
have money, that can go beyond
Yes.
that. So, which is great. Oh, wonderful. Thanks for that.
Mm.
Second question, in your opinion, how wealth and health are related?
I'll talk through like scientific evidence. Like
Sure, please.
yes, yeah, they're very interrelated because there are some evidence-based studies showing that those with higher income tend to have a better health. So they are healthier and they live longer. They tend to, and then they earn more. Of course, like it's no brainer. If you're healthy, you have more opportunity to create more income, you know? Like,
Yeah.
of course, there are other environmental and socio-economic factors that are involved that are sometimes beyond the control of, humans. But for example, people from higher socio-economic status, they will be able to afford better healthcare, like, private insurance. They have more education and they will do more frequent medical examinations. So they detect diseases early instead of like at the complication. So because when treating at the complication is more costly compared to preventing and at that stage. So, and of course, having healthier food choices, organic food choices and all that are more expensive than the cheap instant packaged
True.
meals. So
True.
that's health is sometimes lower income is a health risk also.
Okay.
But in saying that, it doesn't mean that those from lower income cannot adopt a healthy lifestyle. They still, it's still a choice. It's still a personal choice, I feel.
Sure. No, that's great. Yeah, of course. There is always exceptions and other ways to look at it. And even we've seen people who are wealthy, but they are not healthy.
Yes.
So basically somehow they sacrifice their health over, to get the money or doing other things.
Oh, yes,
yeah,
yes.
Yeah. But yeah, it's at the end of the day, it's just that interconnection between health and wealth by itself, not just in isolation. That's what important. It's great. So just tell me this, if money was not an issue, would you still be doing what you are doing right now?
My answer would be like yes and no. Because I'm
Yeah.
a stay-at-home mom now. I'm managing my clinic. But I'm not working like before 7 days a week in my clinic, seeing patients. So I like that break. I'm like enjoying taking care of my child, spending time with him. But something differently I would do if I have financial freedom now is like, and not having like student loans, mortgage to worry about. I would travel more and maybe do something more of an impact, because I feel like I want to contribute, use my skills for something like maybe do medical volunteering, start up a non-profit. I don't know.
Right.
So in essence, do something that is contributing of more of a value, with my time.
Okay. And please correct me if I'm wrong, because to me, still you would be doing what you're doing in terms of doing the medical, so you are doing the contribution in that field. So still you will be doing it, but then you'll do it for free. Isn't it correct?
Yeah,
so that's what it is. It's not that.
Yes, that's it.
Because believe me, in my area of work, so I've seen, because I have many doctor clients and dentists and other professions, and the number of doctors and dentists who said that they were just came to this job doing just because their family wanted and they never liked what they're doing, or now they're doing real estate and doing other stuff, is the number is very frightening. It's just to me that they don't like what they do. They just see the money is good, but they don't enjoy what they're doing. So that's the very interesting aspect. But yeah, I'm glad to hear that you still will be doing what you're doing.
I enjoy seeing patients.
Yes, voluntary and going in that path of philanthropy and those areas. So that's great, wonderful. The next questions. One advice that you will give to your younger selves about wealth creation?
Just one advice?
Please.
Number one is avoid getting into debt. Like avoid getting loans, and get financial education and literacy very early on, because your younger self will thank you.
Yes.
And so that you can because some people learn it very late. If you learn it earlier, you can stand on your 2 feet without getting help from anyone. You don't even need government assistance, anything. You can stand on your 2 feet, do not go after trends, the traps of consumerism, spend,
Yeah,
like that.
That's great.
Yeah.
And so now, please tell me, what do you think when you hear this quote, healthy, wealthy, wise? What does it mean to you?
I've heard of that. I think, isn't that like the 3-step formula for happy retirement? I think, isn't it? Like, but yeah, I feel for me it should be like wise, healthy, and wealthy, because when you have the wisdom to be, to choose healthy lifestyle and create a wealthy mindset, sometimes you can't even get those riches, but you have that wealthy mindset at least,
Oh, that's great. That's great. Yes, honestly, I never thought about it this way, that this is good for retirement. This is a very nice slogan for retirement. I like that. So, but according to you, health and wealth and happiness, are they related?
Yeah, I think it is correlated because, but out of the 3, I put health at top of the list. Okay. Because having overall good physical and mental health is the first priority for me. Because it doesn't matter if you have like gazillion and billions amount of wealth, but you have restrictions on your physical health, and you don't have a good sound mental health, you can't even get a good night's sleep. So that won't lead you to, being happy, to happiness, right? So you won't be able to do things that bring you joy and happiness. They will restrict you if you lack in those departments, I think. So, and wealth, other than the monetary wise, I think having the mindset of abundance, like, you're being content, gratitude, more of that. So, if you put happiness only at a certain amount of money that you have or you reach, then you will only be miserable. Because some people, if I want to be rich like, Jeff Bezos or Elon Musk, but he was like so unreachable, So like maybe put a more achievable target, I think.
Yeah. It's great advice. I remember more than 10 years ago, I had that mindset that I used to have put that monetary value to said, oh, if I get to this level, then I'll be happy. And it was surprise, I got there and I wasn't happy. So what's wrong with me? So that I wanted to get it. This was my whole goal. And then I said, okay, maybe I have to put the bar up. And again, I put the bar up. No, that's it. It was just that rat race. And I felt so unhappy. And that's why about 10 years ago, I thought, no, I have to change something. And I went through that, this mindset, the money mindset, that at the end of the day, we are here to be happy, to, because our time on earth is limited.
Yes. True.
So you might as well be happy and leave a legacy, So then, so instead of finding new strategy, best strategy to make more money or be better at my, work or comparing to my colleagues. So no, I'm just going to reflect back inside and see what makes me happy and how I can spread that happiness to my clients rather than only chasing this dollar sign.
That's very good. Yeah, I think your clients will appreciate that, like other than the financial advice, that creating that mindset also.
Yes, it's very important. I appreciate it. Thank you. So now, as a doctor, so what is your health mantra?
My health mantra, okay. Yes. It's I think you are what you eat. Because it's like most of the diseases come from the gut, from the food we eat. Of course, not all of it. There are genetic predisposition that cause you to have those kind of illnesses, but most of the diseases, like diabetes, high cholesterol, and hypertension are caused by a bit of unhealthy food choices.
Okay.
Because in Islam we have a saying says that our body is our trust, our amanah from God. And it says a human being does not fill any vessel worse than his stomach, because we like to eat too much, I guess. Yeah.
Oh, interesting. Yes, you are what you eat. Yes, that's great. So then obviously you have a very, strict regime around what you eat. So is it correct to say? Or and what else? Is it exercise? I mean, yeah, in
It's
general.
it's
Okay.
moderation in everything in your food. Yes. Like have, of course you try to have all the nutrients in your meal, but when you want to have some days when you have your cheat days, even
Yes.
that even that have it in moderation. Not that okay, you have that cheat day in that 1 or 2 days in a week, and that cheat day is like you just
Go
lump
crazy.
not really, not that's not the
Okay.
way. You can enjoy some of the nice things on nice pastries, desserts. I'm a dessert person, of course, but have it in moderation. Always like you have, you just soothe your craving a little bit.
Yeah.
But
Right.
yeah, when having a meal, of course, have it sitting down, enjoy it, not like rushing while eating. Have a wholesome kind of meal. Better home cooked meal. But if you
Yeah.
can get you buy it outside, still a good wholesome meal.
That's,
Don't go for fast foods, lah, of course.
yeah. That's good to know. Wonderful. And now, please tell me what is your wealth mantra?
I don't, to be honest, I don't really have one, but I
Okay.
have, I
That's
have a
fine.
saying from that says the richest of the rich is one who is not a prisoner of greed. So
Like
it's
that.
one of the companions of our Prophet Sallallahu Alaihi Wasallam. It is, if you have this mindset, then you're already rich. You don't need to chase more riches because you will never be fulfilled by just hoarding and accumulating wealth, I think. Yeah.
Okay, that's interesting. So, and now, what is your view on saving for the next generation? And again, obviously, I mean, because I have a vast number of people as in my audience, so there are people from different culture that they say that no, there is nothing, to leave for the next generation. Maybe they don't, so they have to work themselves, or this money I made it, so I'm going to give it to charity. I won't leave anything for next generation. So, but yeah, which I really appreciate everybody's opinion because at the end of the day, it's their view. So I just like to know what is your view on leaving wealth for next generation?
I feel it is important because you want to secure financial security in the long run. I
Yeah.
feel like, and maybe not leaving too much, but having enough to sustain, because we don't know when we're gonna pass and what age we're gonna leave them. But hopefully
Yeah.
hopefully they already achieve financial education and university education, and get a stable job and everything. But it just to help them to get that independence for a little bit, I guess. Like, I think, but saving is very good. Yeah, any kind of saving is very good. I feel.
That's great. Okay, wonderful. And now please define your lifestyle. So imagine now you are retired and you've done all the work that you wanted to do, working hard with the community and everything, and this is your retirement. How would you picture your retirement?
My retirement lifestyle, I think, would be just a modest one. I have enough, I have enough wealth, not having to borrow and use from what the government pension or
Yeah.
something. I have enough for myself that I would to do the necessary expenses and some leisure activities, maybe some occasional travel. I feel like I'm hoping, that time retirement, I'll be free of any mortgage and debts.
Yes.
Of course, that's like, I don't want to be retired with debts.
Of course.
Yeah, probably that's what I gotta do. Like, probably if I have time, still have good health, I'll be volunteering sometimes, once or and
Nice.
because I'm a person of faith, I would do things that are strengthening my ties with God, like religious studies and all that. Yeah.
All right, no, that's very nice. That's great. So the reason I come to this is my last question to ask is that everybody has a different view of their retirement. They just, some people, they want to say that, okay, that's it. I'm just going to go only travel the world or doing this, or I have so much money, or, I don't know, they have that mansion, or, many different things. But what I'm really trying to give this message to our audience is to know that, of course, you are a doctor, you work so hard to get to level you are in, or somebody like myself, you studied so hard to become to this level. So it's not all about money and things. So we just want to, at the end of at retirement, we just want to be a normal person, just, a funded retiree, that we are still able to, contribute our whatever education, whatever we value back to our community, as long as our health allows us to do some work. And you just be there, just trying to hold this community together and just feel good about ourselves. So
that's true.
We are just about, okay, like I'm a doctor, so I have to do this, or, because people have different perception about what we do. But I think we all, at the end of the day, we all are humans, and in this regard of what's our area of, work or expertise, we just want to be happy, have a happy life, and
mostly we are happy with our family, spend more time with them.
And even the people around us, and not just immediate family. So when you see everybody in the community is happy and feeling content and stuff, so because there is no competition there, you see.
Exactly.
I think the only competition is for ourselves to be happy and find what makes us happy, not just having another handbag makes you happy, or something or a couple of more properties makes you happy. It's all great. So and definitely I'm there. So and but some people, they like to retire then they're 50. Some people, they say that no, I'm gonna work forever, and it's not just because I need money. It's just when they work because I want to give back to community, or I enjoy doing it. So again, coming back to that moderation. And I think the key word from our talk today, from my talk to you, is which really stuck out with me, is moderation. Because with every doctor that I spoke, so I tried to pick one word. So
summary. Moderation, balance.
Yes, that's great. I really appreciate it. Thank you so much for your time. And is any other advice at the end, so you would like to finish off with it?
No, I think that's it.
Okay, that's great. Again, I appreciate your time and wish you a very best of luck with managing your clinic from far away. I know, so it must be very, very interesting and very challenging, especially due to COVID. We cannot even travel to go and check things. But I'm sure you'll be fine. Thanks a lot, and hopefully we see you again soon. Thanks so much.
Thank you so much for having me.
Right.